Welcome to Dr. Martin, Head and Neck Radiology. In today's video, we will discuss the radiological findings of the carotid body tumor, also known as carotid paraganglioma. This entity is one of the most important lesions to recognize in the carotid space because of its characteristic imaging features and clinical implications. We will review two illustrative cases, and then go through the main concepts that every radiologist should keep in mind. Let us begin with the first case. This is a 34-year-old woman who presented with a right cervical mass of 1 year of evolution. A contrast-enhanced CT scan of the neck was performed. On the axial images, we can clearly see an enhancing mass located at the right carotid bifurcation. For comparison, the left carotid bifurcation appears normal, with clear separation of the internal and external carotid arteries. Careful observation reveals that the mass displaces the external carotid artery anteriorly and the internal carotid artery posteriorly, which is one of the most typical radiologic signs of a carotid body tumor. The lesion is oval, well-defined, and shows intense enhancement after intravenous contrast, indicating its hypervascular nature. Inside the mass, a small hypodense area suggests necrosis or cystic degeneration. On sagittal maximum intensity projection reconstruction, the findings are even more evident. The mass enhances strongly, and again the displacement of the carotid vessels is confirmed. Digital subtraction angiography was also performed in this patient, demonstrating a highly vascular tumor at the carotid bifurcation with the same pattern of displacement of the arteries. Based on these radiological findings, the diagnosis of a right carotid body paraganglioma was established. The second case is a 50-year-old man who presented with a painless left cervical mass. A contrast-enhanced MRI of the neck was performed. On the axial fat-suppressed T2 weighted images, we observe a lobulated, well-defined, hyperintense mass at the left carotid bifurcation. Inside the lesion, multiple hypointense linear areas correspond to flow voids, another hallmark of a hypervascular tumor. On fat-suppressed T1, weighted post-contrast images, the lesion shows avid enhancement. Again, the characteristic displacement of the vessels is seen. The external carotid artery is pushed anteromedially, and the internal carotid artery is displaced posterolaterally. These findings, in combination with the flow voids and the strong contrast enhancement, confirm the diagnosis of a left carotid body paraganglioma. In summary, the carotid body tumor is a hypervascular paraganglioma that originates from paraganglionic cells at the carotid bifurcation. It typically appears as a well-defined mass that strongly enhances after contrast administration and causes splaying of the internal and external carotid arteries. On MRI, the presence of multiple flow voids gives the classical salt and pepper appearance. Beyond diagnosis, imaging plays a critical role in surgical planning. These tumors may range from small, localized lesions to large masses encasing the carotid arteries. Therefore, radiological assessment is not only diagnostic, but also predictive of surgical difficulty and potential complications. Another key point is the circumferential angle of contact between the tumor and the internal carotid artery. This can also be categorized under the Shamblin group system. Group 1 corresponds to less than 180 degrees of encasement, Group 2 corresponds to 180 to 270 degrees of encasement, and Group 3 corresponds to more than 270 degrees of encasement. This radiologic classification is highly relevant because it predicts the complexity of surgical resection and the potential risk of vascular injury. When evaluating a carotid body tumor, it is also crucial to look for additional paragangliomas in other locations, such as the jugular bulb, vagal region, or tympanic cavity, since multicentricity is not uncommon, especially in familial cases. For this reason, a careful review of the head and neck should always be performed when one of these tumors is detected. At this point, I would like to invite you to watch another video on this channel about the radiological findings of the glomus tympanicum. This lesion shares many features with the carotid body tumor, and comparing both will help consolidate your knowledge about paragangliomas in the head and neck. You can find the link in the comments. In conclusion, carotid body tumors are rare but highly characteristic lesions of the carotid space. Recognizing their imaging findings is essential for proper diagnosis and management. I hope you found this review useful. If you enjoyed this video, please subscribe to Dr. Martin, Head and Neck Radiology, give it a like, and leave a comment below. Your support helps us continue creating educational content for radiologists and healthcare professionals around the world.